Multiple gestations have higher neonatal mortality rates. More than 25% of deliveries with birth weight under 1,500 grams are from multiple gestations. Congenital malformations are the leading cause of neonatal death in the U.S. Congenital malformations account for about 20% of infant mortality. About 75% of deaths due to congenital malformations occur in the first week of life. 1 in every 33 babies is born with a birth defect. Most common birth defects involve the heart. Chromosomal anomalies such as trisomy 13, 18, and 21 are common. Defects also occur in muscles, bones, gastrointestinal tract, face, brain, and eyes. Prematurity and low birth weight are the second leading causes of neonatal death. Prematurity is defined as birth before 37 weeks of gestation. Prematurity rate in the U.S. is 10.1 to 10.8%. Prematurity rate is 14.8% in black mothers. Prematurity rate is 10.2% in Hispanic mothers. Prematurity rate is 9.5% in white mothers. Lower gestational age is associated with higher mortality. Survival is possible as early as 22 weeks of gestation. Survival rate is greater than 90% at 28 weeks of gestation. Previous preterm birth is the strongest risk factor for prematurity. Inadequate prenatal care increases the risk of prematurity. History of abortion increases the risk of prematurity. Short interval between pregnancies increases the risk of prematurity. Assisted reproduction increases the risk of prematurity. Placenta previa and placental abruption increase the risk of prematurity. Fetal distress increases the risk of prematurity. Erythroblastosis increases the risk of prematurity. Known immune hydrops increases the risk of prematurity. Uterine abnormalities such as bicornuate uterus increase the risk of prematurity. Short cervix increases the risk of prematurity. Incompetent cervix increases the risk of prematurity. History of cervical surgery increases the risk of prematurity. Tobacco use during pregnancy increases the risk of prematurity. Cocaine use increases the risk of prematurity. Chronic maternal illness increases the risk of prematurity. Preeclampsia increases the risk of prematurity. Premature rupture of membranes increases the risk of prematurity. Chorioamnionitis increases the risk of prematurity. Bacterial vaginosis increases the risk of prematurity. Congenital anomalies increase the risk of prematurity. Polyhydramnios increases the risk of prematurity. Oligohydramnios increases the risk of prematurity. Group B, Streptococcus infection increases the risk of prematurity. Sexually transmitted infections increase the risk of prematurity. About 10% of U.S. births are premature. Prematurity accounts for more than 65% of infant mortality and morbidity. 25% of neonatal deaths are due to prematurity and its complications. Hospital transfer after delivery increases mortality in premature infants. Survival rate of very low birth weight infants is about 85%. Chronic lung disease is more common in very low birth weight infants. Cerebral palsy is more common in very low birth weight infants. Developmental delay is more common in very low birth weight infants. Male sex increases mortality risk in preterm infants. APGAR score less than 4 at 5 minutes increases mortality risk. Lack of antenatal steroids increases mortality risk. Bradycardia at 5 minutes increases mortality risk. Hypothermia increases mortality risk. Intrauterine growth restriction increases mortality risk. Intrauterine growth restriction is defined as fetal weight below the 10th percentile for gestational age. IUGR indicates growth below genetic potential. Symmetric IUGR affects all growth parameters and starts early in gestation. Asymmetric IUGR starts late and mainly affects weight. In asymmetric IUGR, head circumference is preserved. Ischemic placental disease is a cause of IUGR. Abnormal placental development reduces uteroplacental flow and causes IUGR. Chromosomal abnormalities can cause IUGR. Congenital malformation syndromes can cause IUGR. Congenital infections such as torch can cause IUGR. Maternal hypertension can cause IUGR. Chronic kidney disease can cause IUGR. Sickle cell disease can cause IUGR. Maternal malnutrition can cause IUGR. Uterine malformations can cause IUGR. Maternal tobacco use can cause IUGR. Substance use disorder can cause IUGR.